Thank you so much. Okay. Last week. Okay. So what I'm showing you guys is the course outline. Okay, thank you. Yeah, and congratulations to the one that got 100% on the quiz, on the immunology quiz. Congratulations, Doc. We'll soon tell you the prize for that anyway. Yeah, but there'll also be another quiz, and I'll tell you the day when you have it in immunology. Okay. Are you able to see my cursor? I don't know if it's visible. Okay. So yeah, we have done. I'm going to show you guys what we have done so far. Okay, thank you. We have done the introduction to the immune system. This was done by Dr. Pasha. I entered in innate immunity, and I also did cells of the immune system with you. So today we're supposed to start looking at adaptive immunity. That's T cells maturation, differentiation, and activation, together with B cell maturation, activation, and differentiation. Also antigen recognition and antigen receptors of lymphocytes. That's all under adaptive immunity. So by the time I'll be done, um, not today, but I'm sure next week, by the time I'll be done with today's lecture next week, we'll say we have done everything with regards to adaptive immunity and innate immunity. Then the next time I will show you the course outline, we'll be doing complement system. After that, we'll look at hypersensitivity, and the last thing that we'll look at under immunology will be okay. The second last thing I'll look at um, to be tolerance. Then the last thing that I'll focus on will be principles of immunological diagnostic techniques. So after I'm done with adaptive immunity, we won't remain with 4 topics to fully finish the part of immunology before you move to the second part of this course, which is microbiology, introduction to microbiology. Okay, so continue staying with me and make sure you read the notes after we're done with the meetings. Okay, I don't know if that was audible enough. Let me just share the screen for today's meeting. So today we'll be focusing on adaptive immunity. That's what we'll be focusing on. Anyone who has a clue, an idea what adaptive immunity is? I'm sure I've avoided of adaptive immunity, isn't it? When introducing the course, we had talked about what adaptive immunity is, isn't it? No idea? Okay, let's start. Okay, so we're focusing on adaptive immunity for today. And the first thing that we'll focus under adaptive immunity is to figure out the different types of, yes, Doc Lezani. Yes, Doc? Doc Lezani? Uh, was that and meant for? Okay. No response. So let me
Oh,
continue with what I
oh,
was saying. Uh,
that
yes,
immunity
yes, Doc.
is also known as acquired or specific immune system.
Exactly. Thank you so much. Okay, yeah. Last time we talked about innate immunity, he said it's specialized kind of immunity, isn't it? We defined it as a type of immunity where the cells that work around it are not specialized to fight a particular pathogen or antigen. Uh, but with regard to adaptive immunity, it's more of the cells under it are basically specialized to fight particular kind of disease, which are going to focus on by the time we are done with um, with this particular section or part of immunology. So now, let me give you basically a picture of what we are going to focus on by the time we're done with everything with regards to adaptive immunity. Just like I had given you a framework in innate immunity, I'm also going to give you a framework in adaptive immunity. So we're going to focus on B cells and antibodies as the first thing, and we're going to discover that B cells and antibodies are in a particular type of adaptive immunity. Adaptive immunity is in two types, or two categories in short. So B cells and antibodies are in a specific type of adaptive immunity known as the humoral kind of type of adaptive immunity. Then after that, we're also going to focus. The second thing, we're going to focus on T cells and T cell receptors. T cells and T cell receptors. And we're going to discover that T cells and T cell receptors basically are found in the other type or the second type of adaptive immunity, which is the cell mediated That's what we're going to focus on. Am I still audible? Okay, thank you. Okay, yeah. So going back to what I was saying, you're going to discover that on your course outline they're saying adaptive immunity receptors. So when you talk about of adaptive immunity receptors, we're going to be focusing on MHC, and we're going to discover that in human beings, MHC is known as human leukocyte antigen or HLA. This HLA you're seeing that I've written up. You discover that MHC in human beings is regarded as HLA. So we're going to define what it is and the type of and the main part under it basically. And the last thing that we're going to focus on is basically how this same MHC, the B cells and the T cells work together to enforce what we are calling adaptive immunity. Because that's our main focus here, to understand how adaptive immunity works and how innate and adaptive immunity work together in a community kind of workshop, if I put it that way. So we're going to focus on these four things by the end of um, this immunology class or the next immunology class. But the purpose is that by the time we're done with adaptive immunity, you'll be required to know everything with regards to how the framework has been given for you. Okay, so we'll start first of all by understanding what adaptive immunity is. So you can acquired immunity, or you can also call it specific immunity. So those are three names that you would see in questions, and you'll be required to understand that they are about adaptive immunity. So for you to activate adaptive immunity, you must first be exposed. This is a statement I've written for you. You must first what be exposed. For you to activate adaptive immunity, there must be an exposure. By exposure, there must be an exposure to microbes somewhere or before, or more of a sensitization, in other words. Innate immunity is what starts first, right, to fight diseases. Right? But now, in a case for you to activate the specialized kind of immunity, which is adaptive immunity, you have to be first exposed. I think of adaptive immunity. I'm sure we all know of a C5, right? We've all heard of a C5, and we have a police. Usually, the police people are the ones that fight, or let me say, create order and peace, isn't it? But in a case where things become so difficult, we bring in what? The C5. So the police, for me, are the innate immunity. Then the C5 come in as the adaptive immunity. You think of them in such a, you think of adaptive immunity in such a scenario. Okay, so now we'll first of all define what adaptive immunity or what specific immunity is. So like I already said, it is also called acquired or adaptive immunity or specific immunity. So it just depends with with how the examiner wants to ask you basically. So you must take note of that. So something that you must take note of also is that even if we are born with a general ability to respond to foreign invasion of inside the body, there is supposed to be a specific response that you and I develop in our lifetime. The way your body fought against chicken pox when you were a kid has made the body to be specialized or have specific cells that can fight chicken pox when it decides to enter your body again. That's what we're talking about. In as much as you have natural immunity cells that fight diseases day in, day out, you also have specialized kind of cells which are specific for particular diseases or pathogens. They fight those particular diseases in a case where that same antigen or pathogen enters the body. Those specialized cells will come and fight off that pathogen. That's what we're talking about when we say or when we describe um, adaptive immunity. So you discover that adaptive immunity, like I had said in the beginning, contains two components or two types. Adaptive immunity is made up of two types. The first type is what we call the cell mediated type, which I'll talk about in a few minutes. And the other type is what we call the humoral type of adaptive immunity. So now, someone will give us questions or will ask us, what is cell mediated immunity? What is humoral adaptive immunity? So I'll first of all focus on humoral immunity. Then that's when I'll now start focusing on cell mediated. So let's talk about humoral type of adaptive immunity. So under humoral type of adaptive immunity, you discover that it is a type of adaptive immunity which involves a particular type of cells that work in it. Now, this particular type of cells are known as B cells or B lymphocytes. So it's a type of adaptive immunity that consists of B lymphocytes and its antibodies. And sometimes you can call antibodies as immunoglobulins. So you shouldn't get confused when I start calling them immunoglobulins. It's just the other name that would use for antibodies. So B lymphocytes or B cells, like you usually call them, they they have what we call antibodies, which have the response or which are found usually in blood and lymph. What's what's the purpose of these B cells and these antibodies? It's the main purpose is that you would find them acting or being activated when a person has been exposed to a foreign antigen. So we would first of all define what a lymphocyte is and what an antigen is. Though I defined it in last week's meeting, if I can recall nicely, but I'll talk about it again. A lymphocyte is a particular type of immunity cell, and an antigen is anything that can stimulate a specific immune response. So if someone asks you what's an antigen, remember that it is any cell or microbe or pathogen that can initiate a specific immune response. So you must take note of that. I'll come to talk about it. What makes a cell an antigen and what makes a cell not to become an antigen. So I'll talk about it in a few minutes. So take note of that fact. Okay. So going back to what I was talking about. So I was saying when you look at a B cell is a particular type of cell under adaptive immunity that you would find outside the cell, or it does its function outside the cell, not inside the cell. So adaptive immunity can be inside and outside the cell. So if it's outside the cell, the particular type of adaptive immunity is called humoral adaptive immunity. if the cell or if adaptive immunity is found inside the cell, the name is cell-mediated adaptive immunity. Take note of those facts. I'll come talk about them. So now, what I'm showing you on the picture right now is a structure of an antibody. So we're going to talk about antibodies in a few minutes because there are 5 of them. But I wanted you guys to take note of the structure of an antibody. We said the humoral type of adaptive immunity uses what? It uses B cells and antibodies for function. So now I wanted to give you a glimpse of how an antibody looks like. You'll be required to know um, the full structure of an antibody. So they are what we call variable constant fragments, variable fragments. So I'll explain on them in few minutes as well. At the time I'll be talking about antibodies, but for now I just want you guys to have a glimpse of how an antibody looks like. It's a Y-shaped molecule. When you see a Y-shaped molecule in immunology, basically that is an antibody. Then microscopically, you would see an antibody like this diagram on diagram B. That's how it looks like. That's how they actually look like. But so I'll come back and talk about them nicely. Okay, let me move forward. I don't see if there are any questions so far. Any questions so far? Or I can continue. Okay,
No, I
I
have
don't
a
see any
question. I
progress.
haven't understood.
Yes, though.
I haven't understood anything.
How far? From where?
I joined the class late, so an overview of everything. Try to take you back.
Okay. Just to give you an overview of what we talked about. So today we said we're talking about adaptive immunity, and I'd given a definition of adaptive immunity, and I said it's a second line of defense after innate immunity. And I said with regards to adaptive immunity, it has basically many names, but some of the names I would give you is it can also be called specific, and at the same time it can also be called acquired immunity. Then I also said with regards to adaptive immunity, there are 2 types. The first type is what we call cell-mediated adaptive immunity. The second type is what we call humoral adaptive immunity. And I started saying I'll first focus on the second one, which is humoral adaptive immunity. Then I'll look at cell-mediated immunity few minutes from now. So I'd say the difference between these two is simple. Humoral adaptive immunity, you'll find it outside the cell. While cell-mediated, even from its name, while cell-mediated immunity, you'll find it inside the cell. Then I said with regards to humoral immunity, the main effectors or the main cells or the main cell which is responsible is the B lymphocyte, also called the B cell. So on the B cell structure, we have what we call an antibody, which helps it to do its function. And this was a picture I was showing of how an antibody looks like. An antibody is also called an immunoglobulin. So I gave you a picture of how it actually looks like, and I said I'm going to come back and explain on what all these VLCH CLs basically mean. But I'm sure you can see the kawat, you can see the keep down up. But yeah, I said I'll be back for it. I just wanted you guys to have a glimpse of how an antibody looks like. It's a Y-shaped molecule which helps B cells do their function. That's what I said. so far. I don't know if you have gotten the concept now.
Thank you so much.
You're welcome, Doc. Okay. Any other question, or I can continue? Okay. So now, going back to what I was saying, antibodies which are found on the cell surface of the B cells act as the surface receptors for the antigen. So what basically, if you remember nicely, under innate immunity, we had the pumps and the dumps, isn't it? And the PRRs basically acting as the receptors for innate immunity. So under adaptive immunity and under the category of humoral adaptive immunity, to be specific, the antibodies act as the receptors for that system. So you discover that the antibody recognizes only a small antigen, or only a small region of the antigen. And that same small region of antigen, this is usually an MCQ possible question. So take note of that. The part that an antibody would recognize on an antigen is a part that we call an antigenic dominant. So take note of that. The part that an antibody would recognize on an antigen for an antibody to give a signal to the B cell and say what I'm touching is an antigen. That part on the antigen is called an antigenic determinant. And most antigens have many possible different parts on their structure that can be regarded as antigenic determinants. So take note of that. So to give you a glimpse of what I'm saying, imagine this is, I hope you have seen my cursor. This is an antigen. I don't know if structures on top of this. So this my shapes just triangle, all these are what we are calling determinants on the antigen. When this antibody touch on this antigenic determinant, it will give B cell what I'm touching is an antigen. Take that. Yeah. So take note of that. So is adaptive immunity something we are born with? Okay. If you remember what I said, the other name is acquired. So it is not activated when you are born. It only activated when you are exposed. Remember in the beginning I said it's a type of immunity that comes about when you are exposed to an antigen. Okay.
Sir, so is it that the same antibodies work like the the PRR in the innate immune system?
Exactly. Exactly, Doc. That's exactly how the antibodies as of humoral adaptive immunity. Yeah. So I don't know if I've answered your question. Yeah. So getting back to what one of the doctors at in immunity. Most is acquired or activated when you're exposed. That's why it is not medically recommended for you, if you become a mother or a father, to make sure that your child is completely clean. They'll never be exposed to bacteria. That's of bad adaptive immunity, in fact, or and developed adaptive immunity. So it's not safe. Make that when you have children, expose them a little bit to dirt and bacteria so that they develop the adaptive immunity. Okay. And let's see if there are any question. Can I continue? Okay, so going back to what I was saying antigenic determinants are always found, or they are found on the cell surface of the antigen, and they give a signal, just like we had the pumps and dumps for innate immunity. So these are what gives a signal to the antibody, which further gives a signal to the B cells that what I'm dealing with is an antigen, and we are supposed to fight it off. So you must take note of that. Each B cell has many identical antibodies on its surface. The specificity of each antibody on the surface of a single B cell is the same. Each B cell has different types of antibodies, and how those antibodies are specified is same for all B cells. So take note of that. Must take note. That's something very important that you guys should take note. So to give you this actually, so in other literature are also called epitopes. I'm sure you have seen um, other books talking of epitopes, isn't it? So now determinants, meaning those parts that can be recognized by an antibody, can also be called epitopes. An antibody of a B cell is able to recognize an epitope. If you're seeing this diagram that I'm showing you guys, this is an antigen with an epitope on top of it. This epitope can be recognized by this antigen. And when this antigen has been recognized using its epitope by this antibody, it will activate this B cell. That's merely the process of adaptive immunity. That's merely the process. It's as simple as that. It's just, yeah. So B cells are lymphocytes, yes, though. B cells are lymphocytes. They are also called B lymphocytes, but the name sounds so complex. So we will rather just call them B cells. Okay. So another picture to make you guys understand better what I'm talking about. You are seeing this B lymphocyte, isn't it? And these are antibodies on its structure. This is an antigen with its epitopes. So now, when these antibodies get to touch any of its epitopes, or in other words, antigen determinants, this B cell is going to have what we call antigen recognition. There's going to be recognition, meaning you're going to activate this B cell. And when this B cell is activated, we're going to bring about what we call the effector function of B cells. And how does the effector function of B cell happen? The antibodies on the structure of this B cell are going to be secreted. And this B cell will no longer be called a B cell, but it will be called a plasma cell. So take note of what is happening. That's very important. So when these antibodies go, they'll go and clamp this antigen, bringing about the same process of opsonization somewhere where we had discussed about it under innate immunity. So the process is just the same. So you first recognize the antigen, then you bring about the effector function of that same antigen. So take note of those important facts. Take note of those important facts. So now, to give you guys a full explanation about antigen determinants, you discover that you'll be required to understand what makes a particular cell an antigen and what makes a particular cell not to be an antigen. So now, if I was to give you, I'll give you three important factors that are used for determination of a cell to be an antigen or not an antigen. So cells which are antigens usually are protein in nature. I hope you're getting that point. And if they're not protein in nature, they'll back a bit on activation of B cells. Okay. So okay, though. Okay. So I was just saying, this B cell would recognize this antigen using its antibodies, Then when it sees this, recognizes this particular antigen, it will secrete the antibodies from its structure. When that happens, then this B cell will be an activated B cell, which will no longer be called a B cell, but a plasma cell. That's what I had said. So take note of that. Okay, so going back to what I was saying about the structure of an antigen. So usually antigens are protein in nature, and protein in nature antigens are more antigenic than proteins than antigens which are lipid in nature. So when an antigen is a protein in nature, it's more antigenic. By antigenic meaning it can produce more of an immune response compared to the one that is made up of lipids. In short, for something to be antigenic, it has to have a complex structure. And you and I know with regards to protein synthesis, isn't it? For you to form a protein, there is a little bit of some complex processes that have to take place. There is transcription, translation, all those um, parts that make it a complex molecule. It has to go under alpha and beta formation, all those structures. So those parts or those processes are what makes it more antigenic, in other words. So a complex molecule is a good antigen. Take note of that. I doubt if I put it in my notes. No, it's not there. Okay. So a complex molecule is more antigenic. Number two, a molecule that has a higher molecular weight. If a molecule has a molecular weight that is more than 500 um, Daltons, in short, is more antigenic. So take note of that. Take note of that. Those are some of the points that make a particular cell more antigenic. Any questions so far? Any questions so far? Okay, silence means progress. Okay, so that's basically an overview of what humoral adaptive immunity is. Okay, there's an hand. Yes, Dr. Fabi. I didn't get your question, Dr. Fabi. Okay, uh, I didn't get the question. I don't know if it was my network that was breaking, but I didn't get the question. Okay. So I think I'll explain Doc Febi's question. What is answered in Doc Karenga's question that I've seen in the chat box. Okay. Okay. What makes a good antigen is an antigen that is that you can that the antibodies can recognize easily and say this is an antigen, or in short, a cell or a molecule that can um, bring about an immune response faster. That's a good antigen. Then, with regards to the 2 points I had said, a molecule, or a cell, for it to be an antigen or a good antigen, it has to have a complex um, structure. So if it's possible, a molecule is supposed to be potent in nature. If it can be potent in nature, then it's better it is a polysaccharide, because we all know that polysaccharides also have a complex makeup, isn't it? Then the other point, for a molecule, a cell, to be a good antigen, it has to have a higher molecular weight, in short. By higher molecular weight, it means it has to be above 500 Daltons. Usually the preferred one is 1000 or 10,000 Daltons for it to be a good antigen. So take note of those points. That's what I was. Those are the 2 points I was talking about. I don't know if I've answered your question. Docs. Think so. Okay, yeah. So that's basically the overview of what humoral immunity is. So now we go to the other type of adaptive immunity, which is cell-mediated adaptive immunity. So I want you guys to take note of the difference. So what is under cell-mediated adaptive immunity? For cell-mediated yes, Doc Esla. I think my network is bad, or maybe because I can't get your question, Doc. Try to type it. Try to type it. Okay, thank you. Okay, so now going back to what I was saying under cell-mediated immunity. Okay, I understand. So going back to what I was saying under cell-mediated immunity, it's a type of immunity that involves T lymphocytes, which we mostly call as what? T cells. So T cells for cell-mediated. So you expect to find T cells inside the cell. You expect to find B cells outside the cell. So take note of those two differences. So just like B cells, T cells also have receptors on their cell surface because they also have to figure out or identify or recognize if something is an antigen or not. So they also have receptors on their structure. And we call those the receptors as T cell receptors. They get to recognize and bind the antigens. That's something you should take note of. Just like B cells are the antibodies, even T cells have their own um, receptors, which we are calling T cell receptors. So you discover that the T cell receptor is a little bit similar to the structure of an antibody, but you never find it being secreted in the blood. You remember when you activate a B cell, I had given you a picture here. When you activate a B cell, you discover that the B cell, after it has been activated, secreting all those antigen structure to become a B cell. But that doesn't happen with a T cell. A T cell will never secrete its receptors outside its surface or away from its surface. Take note of that. Take note. Okay, so to give you also a glimpse of what I'm talking about, this is basically how a T cell receptor looks like. Like I had given you the picture of an immunoglobulin, also called an antibody. This is how a T cell receptor looks like. It also has a transmembrane region down there that is connected to the for the cell of the base of the T cell. Then this is the top part is the T cell receptor. So it has an alpha chain and the beta chain and the nucleus. So it's quite different from how an antibody looks like. So never differentiate, never make a mistake. You are seeing that this one looks like a Y, like it's Y shaped. Then this one is I don't know if you have seen it. Yes, I don't know if you have seen the two structures. That's the difference between the two. So take note of that. You can also be asked on the difference. So never forget difference of these two structures. Take note of that. Any questions on the structures?
Just my question is on the B cell. The,
Okay.
the antibodies, they act in any way to eliminate the antigens, or they are only used for recognition.
Okay. That's a very good question. Thank you so much, Doc. Okay. So now, when the antibodies are secreted, I'll talk about antibodies have like 5 functions. Okay. So I think I can give you two now, not two or one. Okay. The most important one is recognition, like we had said. The second one is when they're secreted. Let me give you let me take you back to the diagram again. Okay. when these antibodies are secreted, they will come and clamp around this antigen so that this antigen can't move and go anywhere else. And when they clamp around this antigen, that clamping around that antigen will activate the other effector cells of the immunity system, cells like the macrophages, the dendritic cells. They will come and phagocytose this antigen because the antibodies had given a symbol that clamped it for it not to move, that shown it to the macrophages that this particular cell has to be killed. So in short, the antibodies also work in the function of opsonization. Remember what I had said when I explained opsonization last week? I said think of it as a fork when you want to eat food, right? Um, the same way is what the antibodies also do. They open opsonization, meaning giving a signal to the macrophages to command phagocytose. So the antibodies themselves do not phagocytose, but they cramp to the phagocytes to command phagocytose that particular antigen.
Yes, that you have.
Okay, yeah. Uh, yes. Any other question?
So in short, the antigens they can also be referred to as the APCs.
Not exactly. You remember? Do you remember the definition of antigen presenting cells?
Yes.
Antigen presenting cells, they basically take to the what to the phagocytes. So, but with antibodies, they don't present. The only thing that they can do is to opsonize. I don't know if you've seen the difference between the two.
Yeah.
One is taking, the other one is just stopping for you to come and take.
All right, I get it.
Thank you. To be more specific about it all, there are basically 5 types of antibodies. I don't want to talk about it in the near future, but I just realized I just have to talk about it now so that you don't get uh, fully confused. There are 5 types of antibodies. We have antibody, hemoglobin G, hemoglobin A, hemoglobin M, hemoglobin E, hemoglobin D. The mnemonic that we use is GAMED, GAMED. And all of these antibodies have their own specific function, which I've already put in the notes, which I'll talk about. So I just wanted to give you a glimpse. So you discover all the functions of antibodies when we start looking at each antibody one by one. If you want to do it now, we'll do it in the next class. I hope that will answer your question. Thank you. Okay. Yes, Doc Sakara.
Yes, Doc, I had a question, or say I have a question. Is an antigen a pathogen, or it is more like it's what makes up a pathogen, or it's something like part of a pathogen?
Uh,
Hello, have you gotten my question?
yes, I've gotten your question, Doc. Okay.
Yes.
Okay. Yeah. So when you have a pathogen, on top of the structure of the pathogen, or on the surface structure of the pathogen, uh, that's how you find an antigen. And that same antigen has epitope that makes it recognizable to other cells. So take note of that.
Oh, okay. Okay,
Yeah,
thank you
though in
very
some
much.
books
Now,
might read them synonymously, but I just wanted to be specific with how they are basically. So take note of that. Hope that's okay.
yes, it's clear.
Thank you. Okay, so now going back to cell-mediated immunity. Remember, I specified cell-mediated immunity uses T cells, and its receptors basically. But there is something that you must take note of that is very important. That there are two types of T cells. There are what we call the alpha T cells or alpha T lymphocytes. These are the ones I'm talking about. Then we also have what we call the cytolytic T lymphocytes, CTL for short, or cytotoxic T cells. In other words, this is the second type of T cells. Though we also have what we call T cell regulator cells, but I won't talk about them now. They're not very important. My main focus is on the alpha T cells and the cytotoxic T cells. So to give you a glimpse of what alpha T cells are, alpha T cells, when they get recognized an antigen that is presented to them, they secrete some specific cytokines. When they produce those particular cytokines, cytokines basically are just chemicals that are produced from an immunity cell, which can either activate more T and B cells, or can either activate macrophages, or can bring about what we call inflammation. I already explained what inflammation is, isn't it? So cytokines which are produced by alpha T cells can either activate T cells, or can either activate macrophages, or can either bring about inflammation. This all happens with the activation of a particular type of T cells, which we call the alpha T cells. And these particular alpha T cells, on their structure, is what we call, or they have what we call on their structure, a CD4 molecule. CD4. I'm sure most of us have heard of CD4. CD4. That person is about to die because they have a low CD4 count. They're just basically talking about T cells. Most of us have heard about it mostly with regards to patients of HIV, isn't it? So when they talk about CD4, they're more of talking about the helper T cells. So take note of that. Then the other type of T cells are what we call the cytolytic, in other books, cytotoxic T cells. When this type of T cells are activated, they bring about what we call cell lysis. In short, these are what kills the pathogens. Remember, the first type doesn't kill, eh? It only activates other systems. But this type of uh, T cell kills, is the one that is responsible for the killing mechanism of cell-mediated adaptive immunity. I think I might record something that I'll send on the YouTube site about uh, how the T cells are activated and how they activate other cells. It's better I put it in a diagram kind of format. I think I'll explain. I'll send it. I'll send the link in the group when I do so. So now, you'll be required to understand something about the maturation of the B cells and the T cells. That's the most important thing that you will be required to know amongst all of what we have discussed. What's the maturation of the B cell and the T cells? How do they get to identify that this particular thing is an antigen or it is not an antigen? That's something that you guys are supposed to take note of. It's a high would basically you'll be required to know it. So you discover that the B cell, both the B cell and the T cells, they all come from what we call pluripotent stem cells of the bone marrow. And I had already explained what pluripotent means. Pluripotent basically just means a particular type of cell or stem cell that can differentiate or that can form other types of cells. And our area of interest right now is the B and the T cells. They are what we call pluripotent stem cells, which form B cells and T cells. and T cells. So you discover that these pluripotent stem cells, first of all, produce immature B cells that mature to become immunocompetent B cells in the bone marrow. B cells are produced and they mature from the bone marrow. I don't know if I've taken note of that. And when they mature from the bone marrow, they go into the bloodstream. They are matured but not activated. Remember the title on the course outline is maturation and activation of B cells, maturation and activation of T cells, isn't it? So there's a process of something being born. It is being born from the bone marrow. After being born from the bone marrow, it also matures from the bone marrow. Then it moves into the bloodstream. So from the bloodstream, it gets to be activated when it recognizes an antigen. That's the life cycle of a B cell. So it is nemed a B cell. The B in B cell comes from the puripotent stem cell of the bone marrow. It is produced and matures from the bone marrow. So it matures from the bone marrow. Then it moves into the bloodstream. From the bloodstream, it gets to be activated when it recognizes an antigen. So it is named a B cell. The B in B cell comes from the okay. Am I still audible? Okay, I think I'm back now. Okay, yeah. So I was saying it is called a B cell. The B in B cell, the B comes from bone marrow basically. So because a B cell is birthed and matures from the bone marrow, it is named a B cell. The B is for bone marrow. So it will develop from the bone marrow. After it matures from the bone marrow, I'll tell you the entire process of how it matures, how it's activated. I'm just giving you an overview of what the entire process is about. So the B cell is produced from the bone marrow, develops from the bone marrow, matures from the bone marrow, then moves into the bloodstream where it gets activated when it encounters an antigen. When it encounters an antigen, it would be activated to become a plasma cell. That's the entire process. That's why you call it a B cell. So it comes from a pluripotent stem cell found in the what? In the bone marrow. What about a T cell? Someone asked me about a T cell. So now a T cell, okay, a T cell also comes from a pluripotent stem cell of the bone marrow. It is produced from the bone marrow to become an immature T cell, but it does not mature from the bone marrow. It moves to the thymus, where it matures to become a what? A matured T cell that has not yet been activated. So because because it matures from the thymus, it is called a T cell. So the T in T cell or T lymphocyte, the T just stands for thymus. So take note of why they named them like that. One of the simplest thing that you should take note about immunology is that they name things simply. It's not like other courses where they try to complicate things by naming them whatever they feel like. For immunology, you can even make a good mnemonic of everything because everything is easily named. So it's called a T cell because it matures from because it matures from the thymus to become a matured T cell, also called an immunocompetent T cell. So take note that an immunocompetent T cell is not an activated T cell. There's a difference between maturation and activation. When something matures, it means it has just um, reached a point where it can be activated. It has grown to a state where it only needs to encounter an antigen to be activated. That's something you must take note of. So all this process happens in the thymus with regards to T cell, and all the process of maturation happens in the bone marrow with regards to B cell. Take note that when we start talking about tolerance, the B and T cells maturation and activation and development are made in such a way that there will be no process where the T cells or B cells produce chemicals that will kill or destroy the entire body in a process that we call autoimmunity. In other words, killing your host cells. So when you talk about tolerance, that will be more of like emphasized. So just in case you don't know where the thymus is, this is where the thymus would find it. It is the like it usually in DR, so take note of where it's found. You might find it as a question in the DR. But take note of how it looks like or where you find it somewhere near the, I think down on the throat there, on top of that. So take note of where it is exactly found. Um, in anatomical description, it's found in the superior mediastinum, if I'll put it that way. So take note of that because you'll be asked questions on that in anatomy. But we are good people. Us in immunology don't ask these questions. We only find it in anatomy. Yeah. So now, what I'm going to end on for today, or for tonight, in other words, on how the entire B cell and T cell activation happens. That's where we're going to end on today. So this is the bone marrow. This is the bone marrow stem cell, also called the pluripotent stem cell. It's called pluripotent because it can develop in a B cell if it wants. It can develop in a T cell if it wants, depending on the requirement of the body. Does the body need more B cells? Does the body need more T cells? So this pluripotent stem cell, which you'll be explained to more in details when I start doing embryology. This pluripotent stem cell will develop into a B lymphocyte or a B cell. It can also develop into a T cell. So when inside the bone marrow, if it decides to, if it develops into a B cell inside the bone marrow, it will be matured from the start same bone marrow since it's a B cell. The bone marrow for birds is also called the bassa or fabrigas. Take note of that. There are some funny questions that they bring. They will ask you what cell matures from the bassa or fabrigas. So you get confused. What are they asking for? But basically, they're just asking for what type of cell matures from the bone marrow. So they might want to get tricky and freaky like that. So take note of that. So in mammals, you call it a bone marrow, but in birds, you call it what? A bassa or fabrigas. So take note of that. So when so inside the B cell, inside the bone marrow, you mature this B cell to become a B lymphocyte, which will go into the bloodstream. From the bloodstream, it will enter either in the lymph node, the spleen, the mucosa, and cutaneous lymphoid tissues. Then, if it enters this places, basically, these places are known as peripheral lymphoid organs. So we have two types of lymphoid organs. We have what we call generative, or in other words, primary lymphoid organs. Then we also have a second type of lymphoid organs, which we call the peripheral or secondary lymphoid organs. So why are they named like this? The first type is named as the generative lymphoid organs or primary lymphoid organs because this is the place where you have B and T cell production and maturation from. But in the peripheral lymphoid organs, also called the secondary lymphoid organs, that's where you have activation of the B and the T cells from. Take note of that. So when it goes in the bloodstream, it will encounter an antigen. When it encounters an antigen, it will be activated from there. So once a B or T cell encounters an antigen, it will be activated. So activation will only take place when it encounters an antigen. So for the T cells, they go into the thymus. From the thymus, they go into the bloodstream. Why they go? They never mature from the bone marrow. In as much as they're produced from the bone marrow, they go to the thymus for maturation. In other words, so take note of the difference between B cells and T cells. They might try to swap the two. So try by all means to take note of that. What you must take note of is that antigen development begins when the antigen or the antigenic determinant binds to a B cell receptor. So let me just take you back a bit as I'm trying to explain what happens exactly inside the lung and the bone marrow. So inside the bone marrow, we have what we call the macrophages. Okay, yeah. So central lymphoid organs are also part of the generative lymphoid organs. They're usually called like that when under tolerance, under the topic tolerance, but central lymphoid organs is just the other name for generative lymphoid organs, which are also called what? Primary lymphoid organs. So don't get confused, eh? Take note of that. I've seen a question in the chat box about that. Okay. So I was saying, in the bone marrow there, a question I expected you guys to ask me is, how does a B cell mature? How do you mature a B cell? You're welcome, Doc. How does a B cell mature? So inside the bone marrow, you have produced a B cell, or you have produced, I've produced a B cell, yes. Or inside the thymus, you have produced, or you have a T lymphocyte. We have what we call presentation of an antigen. So we have the macrophages and the dendritic cells, which will bring a particular type of antigen-like structures inside the bone marrow for the B cells or the thymus for the T cells. So when they bring those antigen like materials or cells, they will take them inside the maturation B cells in the bone marrow and the maturation place for the T cells in the thymus. So they'll present those antigens to test the antigens. I think of it as testing them. Huh? So they'll test the B cells and tell them, are you seeing this? Is this a normal body cell or is it an antigen? Then the B cells or the T cells will be able to say, okay, this is an antigen. Or no, this is a normal cell. So if they are able to differentiate between a normal cell and a T cell using their receptors, for the B cell receptors, we know it's the antibody, isn't it? And for the T cell receptors, we know it's a what? It's actually even called a T cell receptor. Yeah. So basically, when the T cell or the B cell are able to differentiate between a normal cell and the B cell, when they are between a normal cell and an antigen, when that has been presented to them, that's where maturation starts from. So the functions of the macrophages and the dendritic cells, remember what called them antigen presenting cells, isn't it? The APCs. They get to get pathogens and take them to the bone marrow or to the thymus to present those antigens to the B cells, the T cells, which are under maturation. If they get to differentiate between a normal cell and a T cell, then they can move to the second step of their development, which is activation. In short, they have basically undergone what? Maturation. So when they get to bind to the antigen that will be presented to them by the macrophages, they'll proliferate in a process known as clonal expansion, meaning that they're going to produce more of themselves, producing more of themselves, which are matured B cells or matured T cells. And these matured B cells or T cells are able to differentiate between a normal cell and an antigen cell using the receptors that they'll be born with. In other words, that's what you should know under maturation of B and T cells. Take note of that. So B cells, when they get to when they are matured, and they go into the bloodstream, and they get to meet an antigen again. But this time they're meeting the antigen alone with the macrophages being presenting them to them, isn't it? When they get to meet an antigen, the B cells can develop into plasma cells. And plasma cells are a particular type of B cells that secrete antibodies. Take note of that. So B cells can differentiate into plasma cells or memory B cells. What are memory B cells and what are plasma cells? So plasma cells are like what I had shown you some minutes ago. This is a plasma cell. Why? It's because it has secreted its antibodies. But there is a case where a B cell hasn't secreted its antibodies. It's still having its antibodies, but those antibodies have more of like changed because of the B cell meeting an antigen. That molecule is called a memory B cell. It's called memory because it's still having its antibodies. So in short, when I talk about antibodies, I'll explain what I'm trying to say. When a B cell is straight from being matured, it's going to have two basic types of antibodies. That's antibody M and antibody D. Take note of that. But when it wants to become a memory B cell, meaning a B cell that hasn't secreted its antibodies, the antibodies will change from antibody M and D to antibody I, G, and E. Okay, is that okay? That's the difference between plasma cells and memory B cells. So when I talk about those 5 types of antibodies, you understand why I'm saying the antibody M and D will change and become, in short, they'll be lost, and we're going to have antibody I, G, and E to show up and to give us a glimpse at what we are having is an activated B cell. So you, as a medical doctor, you are able to even figure out if a person encountered an antigen, looking at the number of memory B cells you would have in the system. If you're going to have a lot of B cells which are going to have antibodies on their structure, which are antibody I, G, and E, you as a medical doctor, you'll be able to recognize and say, oh, it's like a lot of B cells have been activated due to invasion of an antigen. I hope you're getting the tips of how you'll be getting to diagnose these things. So this is basically recognizes an antigen, then it becomes an activated B cell. After becoming an activated B cell, it can also do what you call clonal expansion, making more copies of itself. And when it makes more copies of itself, if it secretes those antigens, it will become a plasma cell, as you are seeing right now here. That's a plasma cell. Then if it decides not to secrete its antibodies, it will do what we call isotopic switching, meaning from it having antibody M and D, it's going to have antibody G, it's going to have antibody E, antibody I. So those are some of the facts you must take note of under B cell maturation. Okay, any other questions? I want us to end. I think, yeah, we'll end right here. We'll continue from, yeah. Any other questions? Any questions so far for me? So that's the main concept you should take note of under B cell and T cell maturation. Yes, Doc Sakara.
What about the natural killer cell?
Okay. The natural killer cells, if you remember nicely, I didn't put them under adaptive immunity. Natural killer cells are under innate immunity. And last week I talked about how natural killer cells are activated. They're part of the innate immunity, where when a particular type of chemicals are secreted, they are activated. Chemicals such as interferon gamma, even interleukin 12 in other cases, when those chemicals are secreted in the bloodstream, those will go and activate the natural killer cells. And this happens under innate immunity, but not under adaptive immunity. I don't know if I've answered your question, Doc. Have I answered your question, Doc, or you still have more questions to give me? Okay, so just take note, the matured T cell as well will encounter an antigen. When it encounters an antigen, some cytokines will be secreted. In a case, if it's a CD4 T cell, remember when I said the CD4 T cell is also called the helper T cell, isn't it? If it's a CD4 T cell, it will secrete cytokines first of all. Examples of cytokines it can secrete is interleukin 2, which will go and activate the B cells and activate most cytotoxic T cells, or itself it will do a clonal expansion, meaning making more copies of itself. And when it makes more copies of itself, those copies can either differentiate to become CD8, depending with the cytokines that will be produced. When they become CD8, you know that CD8 T cells are also called cytotoxic T cells. These are cells which are able to kill pathogens, or they can secrete more cytokines that will go and activate the B cells. So something you should take note as well, right? Helper T cells can activate the B cells, depending with the reaction. There is a reaction that I had put down here. You see it in the notes. Okay, there you go. So this is a T cell. This is a B cell. On the structure of a B, we have a molecule known as B7.1 and B7.2. Then on the T cell, we have the MHCs, which when they react with the B cell structure, they are able to activate the B cells. So you find it in the notes. I'd put that in the notes. Yeah. So now the T cells, when they're activated, like I had said, will produce cytokines. Either the B cells, macrophages, or they can bring about. So take note. Of that. Any other question? I think for today we'll end from here. Then we'll start next time we meet. We'll start from here. Any other questions? Any more questions? You're ready for a quiz? If you don't have any question, or maybe I don't put out the quiz. Any question? Okay.
No question.
So we're going to have a quiz. I'll tell you when we're going to have a quiz of what we have done so far. We're going to have a